Welcome to Renal Ultrasound. This is for the pediatric MS3 clerkship. We're going to go over some basics of pediatric renal ultrasound, as well as a few cases. In any focused bedside ultrasound, you're asking yourself a few particular questions, and in this case, we're asking one question: whether or not hydronephrosis is present. So quick tips on renal ultrasound. You want to use your low-frequency curvilinear probe as seen on the left of the screen, or your phased array probe as seen on the right. The left kidney is higher and more posterior. Here's a normal pediatric kidney as seen on ultrasound. You can see the cortex, which appears hyperechoic, the medulla, the renal pelvis, which is where you're looking for hydronephrosis, and in pediatric patients, you can see renal pyramids. Renal pyramids are not usually seen in adult patients and should not be confused for hydronephrosis. Hydronephrosis is the dilation and distension of the pelvis and calyces. It's graded on a scale from 0, mild, moderate to severe. On mild, you have dilation of the renal pelvis. Moderate, you're starting to get some dilation and distension of the calyces. And in severe, you're starting to get complete blunting of the calyces themselves with encroachment into the pyramids and medulla. Here are some examples of hydronephrosis as seen on ultrasound. Mild on the left, mostly limited to just the pelvis. Moderate in the middle with some beginning of dilation and distension into the calyces, and severe marked dilation and distension involving the calyces and the pelvis. Here we can see a normal kidney on the left as compared to a kidney on the right, which has mild hydronephrosis. So here's our first case. We have a 5-year-old female. Mother's bringing her in for foul-smelling urine for a few days. She's maybe had some low-grade fevers and some vague abdominal pain. They've given her some ibuprofen. She has a history of multiple urinary tract infections in the past, otherwise no significant medical problems. Heart rate's 98. She's afebrile and satting 100% on room air. She doesn't appear toxic. She has good cap refill and moist mucous membranes. She has a little bit of suprapubic tenderness and maybe some flank tenderness. The UA in the office shows positive nitrates and leukocytes. So your differential here is pretty easy. Urinary tract infection, pyelonephritis, maybe an infected kidney stone, or vesicular ureteral reflux disease, which has been causing her multiple urinary tract infection. So at this point, you're thinking she probably has a urinary tract infection and can go home with some antibiotics, but you're going to pull out your bedside ultrasound to still take a look at both kidneys just to make sure there's not something else going on. This is what you see. This is how both of her kidneys appear. As you can see, there's the cortex, the medulla, the pelvis, and the pyramids. And there doesn't appear to be any dilation or distension of the renal pelvis or calyces, so there's no hydronephrosis. This is probably a simple urinary tract infection. You could place her on some antibiotics, send her home, and have close follow-up. Case 2 is a 15-year-old female presenting to the clinic, feeling feelings of urgency, but not really producing a lot of urine. She started having some severe back pain yesterday, more on the right than the left. Her last period was a week ago, and she has no significant medical problems. Heart rate is 105. She's afebrile, satting fine. She appears uncomfortable, clutching her right kind of side. She's pacing the room, not able to find a good position. On exam, she has some suprapubic tenderness and some right CVA tenderness more than left. You get a UA in the office, which shows leukocytes and blood, and you also have a negative pregnancy test as well. So your differential urinary tract infection, pyelonephritis, maybe a kidney stone. You're wondering, can I just send her home, or does she need further workup at this time? So you do a bedside ultrasound, and as you can see on the right, there's moderate hydronephrosis, and the left appears normal. So it'd be a good idea at this point to probably send her to the nearest emergency department or to admit her for further workup so that you could check some labs and maybe obtain further imaging. So in summary, bedside renal ultrasound is quick and easy to detect hydronephrosis. Scanning tips: the left is more posterior and higher. If you have a patient with a large body habitus, you can roll them onto one side. Like you could roll them to the left to look at the right kidney, roll them to the right to look at the left kidney. And make sure not to mistake renal pyramids for hydronephrosis. Thank you.